world-renowned expert, Dr. Ashish Jha, also director of the Harvard Global Health Institute. Just to ask you, what would you say, sir, on the outlook in the United States today? Last week, top experts had warned that we could see a Pearl Harbor moment again in the United States. Do you feel optimistic today that that will not happen, or is the worst still to come?
Yeah, good evening, and thank you for having me on. The U.S. is probably going to have its worst week, I think, this week and next. We are heading in the right direction. We've had, social distancing, almost a national lockdown, almost the way India has for about 3 weeks now. And I think we are in the worst of it, probably, as I said, this week or next. And then all the evidence says that it will start getting better after that.
Dr. Jha, what's your view on India from where you are today? Because often amongst Indian policymakers and many Indian politicians we've spoken to off the record, the feeling is that we shouldn't do what the United States did. In fact, that's why perhaps Prime Minister Modi announced a lockdown very early into our curve. Would you think that perhaps globally the India model has worked versus, say, the United States model or the United Kingdom model?
Yeah, so I think all of the Western democracies, Italy, not all of them, but many of them, Italy, the UK, Sweden, the US, have really made a mess of this by waiting too long to lock down. And they didn't really do a very aggressive testing strategy either. So India, I think, I have been saying from early on, India needs to scale up its testing much more than it has. I still believe that is true. But the India model of locking down early was very smart. I think it will save many, many lives. Of course, it still raises important questions like when is it the right time to end the lockdown, and how does India prevent going back into lockdown? Those are still very important questions to answer.
A question I think perhaps faced, and interestingly, of course, right now, there's a controversy in the New York Times and others, and President Trump versus Anthony Fauci, which is playing out in the US media and Twitter as well. You had recommended that perhaps social distancing measures and tougher measures should have been done much earlier. Do you feel that perhaps the administration was slow on that? In fact, President Trump's India trip is also being mentioned in that he took his eye off the ball on the coronavirus happening back home while he was at that moment diplomatically engaged in India as well.
I don't think there's nobody across the entire political spectrum who disagrees with the idea that America was way too slow to respond and basically ignored many, many, many weeks of warnings. That is broadly held by all experts, I think all political analysts from across the political spectrum. Even during the India trip, there was clear evidence that this was going to be a very serious problem in the United States. Our public health officials were speaking up about it, and the entire federal leadership from the president on down really downplayed it, hoping that if they ignore the virus, that somehow magically the virus will go away. Of course, we know that ignoring the virus doesn't make it go away.
The big challenge, and I think this is both for the United States and America, the very different issues, is, of course, the question of lives versus livelihood, as Prime Minister Modi has put it here. And, of course, in India specifically, the issue of how to protect the poorest of the poor who have been hardest hit. What would you see, Doctor, as the best way to actually come out of a lockdown with many migrant workers, etc., saying without the livelihood, we'll die of hunger rather than of the virus?
Yeah, no, this is a very difficult situation for India. Social distancing lockdowns do work in preventing the spread of the virus, but of course they have a very large cost on everybody, but particularly the poor, the daily wage worker. And so the choice here cannot be between lockdown and letting people die of hunger versus letting people die of the virus. That's why the government really has to put in a very aggressive support program, making sure there's food and there's money going to poor people, to migrant workers, and then unlocking as soon as it is safe to do so and staying open. That's why I think it's so important for India to develop a very aggressive strategy to stay open after the lockdown ends.
And of course, in the United States, you're facing similar questions on whether the economy comes first at this time. We know that President Trump seems to be wanting to push to have May, perhaps the first week of May, as some kind of opening. In your opinion, is that wise?
Yeah, no, look, we don't, I always say, this is a line actually from Dr. Fauci, that we don't get to make the timeline, the virus gets to make the timeline. So we can say we want to open May 1st, but if the country is not ready and if the number of infections is too high and our testing capacity is not where it should be, then opening up will just be a disaster. And so the question isn't when to open, it's when do you open so you can stay open. And May 1st, by no assessment is May 1st that time. It might be that later part of May, parts of America can open, but we have to let the evidence and data drive that decision making, not some time in our minds of when is a good time to open.
Does it worry you, Doctor, when you see President Trump retweeting "Fire Fauci" and the whole question of really who gets to decide? Is it about political timelines? Should there be a much more? I mean, you've also got a presidential election coming up. Should it be much more about the country really listening to science at this point rather than other issues driving it? Are you worried by what you're seeing around you?
You know, I'm always worried that people are not going to pay attention to the science. But so far, I feel like despite all of the bluster about Tony Fauci, this or that, the bottom line is Dr. Tony Fauci is the most trusted man in America on this outbreak, and he's still part of the White House task force, and I think that's good. And despite, for instance, the president wanted to open up the country by Easter, but he listened to the scientists who said that would be a very bad idea, and he's extended things. So I mostly try not to pay too much attention to what people are saying, and I try to pay attention to what people are doing. And right now, I think the president is doing the right things by keeping the country locked down. And we will see what the data says about when we open and how we open. And I will, of course, always push for paying attention to science, because that's the only way to beat this virus is to use scientific principles, not anything else.
In fact, Doctor, of course, is in a position as Director of Global Health. Every country has come up with its own way of trying to fight this virus. Some have worked, some haven't. There have been some worrying concerns in South Korea of patients who've tested negative, then coming out and testing positive again. Which are the models that you think have worked, and which do you think have been disasters? There's good news coming from Europe, but at the cost of so many lives.
Yeah. No, so we know that there are some countries who have done a much better job than others, and they are all over the world, meaning that we do have a lot of these East Asian countries: Taiwan, South Korea, Singapore, even Japan. Initially started slow, but I think has done a good job, but then is having some problems again. Germany has done a relatively good job, but other countries like UK, Sweden, US, Italy, Spain have not done a good job, and then have had to respond. If you fall behind, it's very hard to catch up. India, I think, has gotten ahead. I want to make sure India uses that extra time to make sure they can stay ahead of the disease and not fall behind once it opens up again.
So what would be, Doctor, really your big message to India tonight? You mentioned at the beginning of the interview that now how to come out of the lockdown is the biggest challenge. But what would be your big message to India tonight and to Indian policymakers?
I would say three things. First is you have to keep some amount of social distancing in place even after you unlock. You can't go back to business as usual. Second is you have to focus on preparing your hospitals, because when you open up, there will be more cases, there will be a surge. You have to focus on protecting doctors and nurses and making sure there's enough equipment. And then third, and this is very, very, very important, is India has to even now do much more on testing and isolation than it is doing. It is making progress on testing, but not nearly enough. If India wants to stay open, if India does not want to have to do another lockdown in 2 months, the only way to do it is to have a very extensive testing strategy. And I'm worried that India does not have as extensive of a strategy.
Do you find, Doctor, as we go that, of course, that the BCG vaccine, and that's now a focus of studies in the United States as well, that do you think the BCG vaccine, which is compulsory in India, has actually given us a greater immunity? And do you think rising temperatures will help? Because that's another big focus of hope, I think, perhaps based more on, not on actual medical evidence so far, but on hope that high temperatures will help. India is already hitting 40 degrees in some parts.
Yeah, look, I'm hopeful that many, many things will potentially help. The BCG vaccine, there is very little evidence. It's not strong at all. I would not count on that as a major source of protection. In terms of temperature, there is some data that there might be some seasonality. Summer will help, but I'm not, again, counting on that as a major source of benefit. Again, what we have to do is the three things I mentioned: distancing, getting hospitals ready, and testing. Everything else is just hope, and hope is not a strategy.
Of course. Dr. Jha, thanks so much for joining us tonight live from Cambridge, Massachusetts. It was great talking to you.